Hi, my name is Vinicia Cortez. I'm applying for admission to Jacksonville State University's Doctor of Nurse Practitioner program, and this is the story of me. I currently live in Hopes Bluff with my husband of 20 years and my two children. My son is 19 years old. He's a freshman at Jacksonville State University. He's currently doing prerequisites for nursing school. My daughter is 15 years old. She's a freshman at Hopes Bluff High School. I graduated from Jacksonville State University in 1995 with a Bachelor's of Science in Nursing. The first position I accepted as a registered nurse was with Gambro Healthcare in Gadsden, Alabama. Gambro offered acute and chronic hemodialysis for area patients. This was a wonderful learning experience for a new grad. The patients were very complicated. There were very few of them that only had renal failure. As a result of that, I learned that it is imperative that you study and learn about different disease states. I studied guidelines and protocols for diabetes, hypertension, congestive heart failure, nutrition, anything else that my patients had questions about, because I quickly learned that nursing means more than giving medicine and covering the patient up. I worked for Gambro Healthcare until April of 1996. At that time, I got married and moved to Phoenix, Arizona with my husband. I accepted a position with Renal West Phoenix as a chronic hemodialysis nurse. I was their second shift charge nurse, and Renal West Phoenix patients taught me a great lesson on cultural diversity. The patients were very different in the Southwest than they are here in the South, in Alabama and in Gadsden. In nursing school and in Gadsden, I had been taught to assess, triage, and treat the most critical patients first. That did not work all the time in Phoenix, Arizona. We had a very large number of Navajo Indians that we did dialysis for. They were bussed in from the reservation, and they have got a very rich culture, but they have got a very strict hierarchy on how they will let you take care of them. The Navajo Indians have a very high prevalence of renal failure due to dietary habits and a pronounced proclivity for excessive alcohol consumption. They would come in and they would be extremely fluid overloaded. Their elderly patients had to go first according to tribe hierarchy. The elderly patients were usually in much better shape than the younger ones were. Their dietary habits were better. They had a lot more knowledge about how to maintain their disease state. And they tended overall not to be nearly as sick as the younger ones were. The younger ones would come in and they would have massive fluid to be removed from them. Lab values, potassium, out the roof. But they absolutely would not let you touch them until you had taken care of the elderly. I learned to split my staff and my unit into pods so I could get the older patients taken care of on the machines quickly so that the younger ones would let us begin to assess them. This was a lesson for me that I am not in charge of the patient's care unless the patient is compliant and on board with that. I worked for Renal West Phoenix until August of 1997. At that time, we moved back to Alabama. We had found out that my son was on his way. We didn't have any close family in Phoenix, my husband or myself, either one, and we wanted our child raised in the South around our family. So we began seeking a way to come back. Nursing had an overabundance of nurses at that time, and the pay was very low. I did manage to find a position, however, at Gadsden Regional Medical Center on the 8th floor. The 8th floor at that time was a med-surg unit and cardiac step-down. However, the hours were not good and the pay was very low. For these reasons, my sister encouraged me to apply to pharmacy school. I had done most of the prerequisites for pharmacy school prior to nursing school, so I only had a few to finish up. I applied for admission to Stanford University's School of Pharmacy and was accepted. I began pharmacy school in August of 1998. I worked for the hospital until November of 1998 when I went back to work for Gambro Healthcare as a dialysis nurse. I functioned as their charge nurse on the weekends, holidays, and any time I was out of school until I started my pharmacy externship in the summer of 2000. I did graduate from pharmacy school in 2002 with a Doctor of Pharmacy. Since then, I have been employed in the field of pharmacy. The experience that I have in nursing since then has been on a volunteer basis. However, I have helped every patient in any way that I could. I have found information about any disease state. I have given 1,000,000 flu shots, vitamin B12 shots, anything I could do to stay in touch. I have maintained my registered nursing license throughout my career and kept my continuing education up. My nursing philosophy is always evolving. However, the philosopher I identify with most at this time is Virginia Henderson. She has 6 points to her philosophy that I would like to discuss. The first is advocacy. Advocacy is anything that you do for the patient. This could include talking to another provider that maybe don't have as much insight into the patient's home life. It could be arranging for a social worker to help provide transportation to and from a referral. It could be finding a patient assistance program to help the patient get the medicine that they need to help them at the time. The second is knowledge. I fully believe that knowledge allows patients to make appropriate decisions. It is up to the provider to provide that knowledge for the patient. If the patient doesn't know the consequences of their disease, if they don't understand what you need them to do to comply with therapy, they're not going to be compliant. The third point is equality, which is imperative to nursing practice. Nobody is superior to another patient or another person based on their birthright, the color of their skin, what sex they are, or their economic situation. You must take care of patients as sick people, not as a personal preference. The next point is economy, which is essential to nursing practice. I wish that healthcare resources were unlimited. That would be wonderful for us, wonderful for the patients. However, that is not the case. They are finite and they must be managed responsibly for each individual patient. The last point is continuity of care, and this is vital for nursing practice. Continuity of care is defined as the process by which the patient and the provider are cooperatively involved in ongoing health care management toward the goal of high-quality, cost-effective medical care. Continuity of care includes working with a healthcare team for the benefit of the patient. My interest in this program is that I would like to expand my nursing practice. I have enjoyed the field of pharmacy, but I am not able to be as close to the patients. I'm not as involved in their care as I would like to be. As a member of a healthcare team, I do participate in the decisions and the formulary choices for them, but I want to get back to being able to talk with the patients. I have a lot to offer. I have a really good perspective from several different angles. As a patient, as a nurse, as a pharmacist, I've worked with a lot of providers. I am at an age and I have had enough experience in the medical field that I feel like I can offer a good quality of care in a cost-effective manner for the patients. And I'm asking for a seat in the inaugural class of Jacksonville State University's Doctor of Nursing Practice program. Thank you.